to Doctor Yes to the program. Live at YouTube or live on YouTube, beg your pardon, at WFM 917, or you can listen to us on the go via our website www.wfm917.com. The phone lines will be open later in the program, so stay with us. Like I said, it's 10 minutes past 10. It's beautiful Monday morning, and you are tuned into Women Radio. You're listening to Radio Doctor. Dr. Akiola, good morning. How are you this morning?
Morning. Nice to join you once again this morning and happy new month.
Thank you, Doctor. I should have said that already. How was your weekend?
My weekend was good. I was able to have some rest. It was very good.
Okay, let's get into it, Doctor. What exactly is urinary tract infection?
Um, Urinary tract infection is a bacterial infection that affects any parts of the urinary system, you know. And when you talk about the urinary system, it includes the bladder, the urethra, the ureters, and the kidneys. So, urinary tract infection is when the bacterial infection affects all any part of this of the urinary tract that I mentioned earlier. Then you describe this as urinary tract infection. And the most uh, common bacteria that usually affects the urinary tract is what you described as E. coli. E. coli bacteria is the most bacteria that affect the urinary tract infection and usually enter the urinary tract infection through the urethra.
All right, all right. How common are they among children?
Um, Urinary tract infection occurs in about uh, 80% of girls and about 2% of boys. So it's common among children.
Did you say
But
80% of girls and 2% of
sorry,
boys?
uh, 8 8% of girls and 2% uh, of girls of boys. Sorry.
All right. Why are they more common in girls?
Pardon?
And why are UTIs more common in girls? Because based on the statistics you gave, you said girls have 8% and boys 2%. So why is it that the girls' statistics is higher than that of boys?
Because of the anatomical part of the uh, of the girls, they have a short urethra, which is also in close contact with uh, the anal opening where feces come out. So, and if the I mean you are not I mean if you are not careful, the fecal part can easily enter into the urinary part. You know, if you are not hygienic enough. So, and that is, I mean, that is the reason why girls are more prone to UTI than the boys because of the anatomical area of which there is close adjacent the urinary tract opening and the anal opening where feces comes out. They are very close together. So if you are not careful, and you are not hygienic enough, you can easily transfer the fecal bacteria into the urinary tract. And they also have a very short urethra, which allow this bacteria to easily ascend into the other parts of the urinary tract.
All right. Thank you, doctor. At what ages do you see urinary tract infections most frequently?
Um, Mostly it's infant under the age of 1 year, the toddlers. It's more common. Urinary tract infection is more common among the toddlers, and infants below the age of 1 year.
Okay. Many parents expect painful urination, but children don't always present that way. What are the symptoms of UTIs parents should look out for in their children?
Um, the symptoms of urinary tract infection includes burning pain. Though you mentioned that children don't, but because most of them may not be able to inform you that they are having pain. But most commonly, what
Doctor, I just want
parents may
to
notice,
ask you. I want to
what
understand.
parents may,
Are you saying the
hello,
pain is there, but the children don't know how to express themselves?
well, yes, it may be there in some older children, but they may not be able to express themselves. You see them crying, getting irritable. They may not be able to actually tell you that they are having pain. So the most common features of urinary tract, especially, I mean, let's start with the toddlers, the babies and toddlers. You have fever, you know, they come, without no clear cause of the fever. You just notice that this child is running fever. And if you check any other parts of the body, you may not really see any other obvious signs that may cause this fever. But they start running fever, high fever, if you have a high index of suspicion that probably this may be due to urinary tract infection. They become fussy, they cry a lot, babies and toddlers, they cry a lot, become fussy. That's why I'm saying that even this pain that you are saying is not maybe there, but because they can't tell you exactly that this is where I'm having pain. So they express this in form of fussiness. You know, they cry a lot, they become irritable, not eating. You know, they be feeding poorly for infants, for toddlers that may not be able to express themselves. Some of the common complaining they are not feeding poorly. The other thing is they may be having vomiting or diarrhea even when they are having and the cause may be the urinary tract infection. For older children, you know, these ones they will be able to express themselves. So they may complain that they're having pain, you know, burning pain when they are peeing. If they want to go and pee in the bathroom, in the toilet, they complain that mommy, I'm having pain, when I'm weaned. Then they always have this strong urge, the urge to go and pee often. You see them visiting the toilet or bathroom more often to go and pee frequently. That's what you call urinary frequency. So it occurs in older children and even in adults when they have UTI. Uh, Other things you may notice is new bedwetting, which may occur daytime or any daytime, during the daytime or at night, especially in a child that has been totally dry of bedwetting before. You just notice that this child suddenly come and start, bedwetting. So you have high index of suspicion that this may be due to urinary tract infection. Then they may complain for an older adult, an older child may also complain of belly or lower back pain. Complain that I'm having abdominal pain. The abdominal pain they are complaining, especially the lower abdominal pain, may be related to UTI. Then, if you notice, uh, as parents, when they wee, you notice that they have cloudy or bad smelling, foul smelling pee. Those are the symptoms that you may notice when a child have UTI. So, if you suspect that your child have UTI, note the age, and these symptoms that we mentioned, so it can doctor to suspect or make a proper diagnosis of UTI in children, when the doctor is taking history at the hospital.
Okay, thank you, Doctor, for your explanation. The phone lines are now open. Today we are discussing urinary tract infection in children. If you've noticed that your child complains of pain when passing out urine, please call in with your questions. You can call on 0800 1235 917 or 07000 or 09155 917 917. You can send a text or WhatsApp message to 07031 or 08155 917 917. Okay, so doctor, what is the process to find out if a child has urinary tract infection?
Please, can you repeat the question?
What is the process to find out if a child has urinary tract infection?
Sorry, pardon, I didn't hear you well.
What is the process to find out if a child has urinary tract infection?
For you, I as a doctor, the process, involve taking good history. When it's taking history involve asking questions, related to the symptoms I've just mentioned earlier. If there is a burning pain, if you notice urinary frequency, if you notice cloudy urine, if you notice fast smelling urine, and for a toddler or an infant, is the child irritable? Is he feeding well? Is there any fever? Those are the things I would like to know, and which the parents should be able to take cognizance of before coming down with the child to the hospital. Then you want to do a proper examination, confirm if there is fever, and examine the patient, do abdominal examination, and eventually we may need to take sample, for blood, either to exclude other cause of fever in a toddler. We also take urine sample, especially the midstream early morning urine. You know that for urine MCS, which to uh, for urinalysis and urine MCS to be able to test for urinary tract infection.
All right, doctor. Which children need further investigation, such as kidney ultrasound or other imaging after a UTI?
For a child that usually have a recurrent UTI, then if the child come often with UTI, you may need to, and if it's treated and yet they still come with UTI, you may need to further investigate to find the cause. Is there a congenital abnormality of the urinary tract? You want to check the ultrasound to check that will check the kidney, the urethra, and the bladder to be able to check if there is any malformation or if there is any problem along the urinary tract that predispose these children to be having urinary tract infection.
Okay, doctor. Beg your pardon, when does a child with a UTI require admission to the hospital instead of being treated at home?
You said,
When does
hello?
a child with UTI require admission to the hospital instead of being treated at home?
For a child that is having fever and at the same time you've administered antibiotics and despite that fever is not controlled, you may need to do further investigation to look out for the best antibiotic to treat this child. So the child may need to be admitted. And for proper investigation, especially for those that are having recurrent UTI, may need to admit in the hospital. And if there is a severe infection that affects uh, the upper part of the urinary tract, the kidney, there may be need to admit to for proper investigation and administration of antibiotics to take care of the infection.
So, which complications can occur if UTIs are missed or left untreated?
Uh, Complication that may occur with if urinary tract infection is not treatment include sepsis, uh, and may also include, I mean, it may affect the kidney. Sepsis is especially along the urinary tract can spill into the body and cause severe sepsis in children. And it's a life-threatening body reaction which happen when urinary tract infection spread into the bloodstream. Um, we also have kidney. The bacteria can travel from the lower urinary tract and travel from bladder to the kidneys, causing pyelonephritis, and it can result in a lasting damage, or permanent scarring of the kidney. And when you have lasting damage or permanent scarring of kidney. It can later affect this child, causing hypertension and also uh, causing other organ damage.
Let's talk prevention. What can parents do to reduce the risk of urinary tract infections?
Um, Prevention of to prevent urinary tract infection, we advise that parents should ensure that their what or their kids they drink plenty of water after after every meal. Then also as soon as you notice all these symptoms, please let's take these children to hospital to see a doctor for proper treatment. And also, there should be handling the ID part is also very, very important. For anytime that the children have to use the bathroom, ensure that the genital area is properly clean, especially for kids. They should clean to backward rather to clean forward, especially that genital area. Should be to clean properly. Then to encourage our children to use toilets frequently, so so that they don't hold urine for too long, and encourage them to also to completely empty uh, their um, their bladder when they need to to make use of urine. To make use of the bathroom to urinate, and as much as possible, we should uh, prevent constipation by eating high fiber food like fruit and vegetable to ensure regular salt bowel movement that do not press on the bladder. Then I mentioned earlier for cleaning direction, teach guests to always wipe from front to back after using the toilet to keep bacteria away from urethra. And for those that are still using diaper, change wet or soiled diaper promptly for younger babies to keep the skin clean and dry. Then choose loose fitting cotton underwear and avoid tight pants for the children. Then avoid bubble baths, scented soap, and caffeinated drinks that can irritate the bladder, and ensure that the children drink plenty of water throughout the day to help flush out the bacteria naturally.
Doctor, I want to understand when you say scented soaps, because many of us we buy specific soaps for the babies. Are you saying scented soaps or specific type of scented soaps, or should we buy soaps that are approved only by dermatologists for children and babies?
There are some soaps that they put some chemicals, either to make it appealing, fragrance, and they end up causing serving as irritant to the skin. So all those soaps, should be avoided. It's even better to clean the genital area with plain water than using soaps or scented soaps.
All right, thank you, doctor. How concerned should parents be if their child has had more than one urinary tract infection?
By the time you're having frequent one or two, you know, UTI within 3 months, it's important that we need to find out what's the cause of the urinary tract infection. Is it due to bladder anomaly? We need to, that's what will involve um, going further to do ultrasound to check the anatomy of the urinary tract. And we may need to do some other uh, scan to check the kidney and every other part of the UTI. So, why? Because uh, the earlier we prevent uh, recurrent kidney infection, pyelonephritis that can cause kidney damage, kidney scarring, the better. Because when there is kidney scarring, it may lead to other complications in the future if it's not well managed, such as hypertension, which may also affect other organs like the heart, and cause further damage.
Okay, okay, okay. Thank you very much, doctor. You've exhausted this topic well for us. I hope parents are listening and taking notes. So, doctor, this is like a major issue in our society. You see, parents give leftover medicines, in this case, antibiotics, whenever their child develops fever. I said at the beginning, I said we're going to come back to this malaria. My head is paining me, malaria. Leg is paining me, malaria. Every time they always have solution for pains and complaints. Why is this dangerous? Those giving of leftover medicines. Maybe the child has completed the dose and then, oh, I'm having fever, I'm having headache, antibiotics again. What is the danger in it?
Um, Use of less leftover drugs without prescription is what is described as misuse of drugs, misuse of antibiotics. And it's a very common thing in this part of the world because we easily get access to over the counter drugs to buy uh, antibiotics, anti-malaria, or any drugs that that are used, for treatment of common ailments, and which is not common in other parts of the world. You cannot just go and buy medicine, you know, in developed world without prescription. Nobody will answer you. Even nowadays, you see uh, people going to the chemist or and requesting for antibiotics without without prescription. Even some of these providers that they don't we just even miss one or two drugs and send to them. Some of them will take the dose 1 or 2 days, they won't complete it. So it's a very um, harmful behavior, and it leads to uh, antibiotics resistance. It leads to severe secondary infection, and uh, leads to other harmful side effects and complications. You know, because this medicine, they are used incorrectly. When they are not needed, they cause serious health risk for both individual and also to general public.
Finally, doctor, what are the three most important things every parent should remember about urinary tract infections in children?
Um, what we should know is that as parents is that urinary tract infection is common in children, especially among toddlers. Um, you realize that um, most of the time when our toddlers are having fever without any other signs and symptoms, you know, it's not only malaria or typhoid that cause fever. Uh, some of these fever are caused by urinary tract infection. Um, so when you notice fever or urinary frequency, as I mentioned, in older children, or cloudy urine, or in older children, or smelly urine, notice that something is wrong with the urinary tract. And as much as possible, as parents, way to prevent, untreated urinary tract infection can affect the kidney and leads to kidney damage. And as much as possible, we want to prevent kidney damage because they also have leads to other complications, in the body. So as much as possible, ensure that our children are well hydrated, maintain good hygiene, change diapers frequently for those that are using diapers, and for older children, as soon as they use the bathroom, ensure that you clean the genital area, to prevent uh, the bacteria from ascending through the urethra into the other parts of the urinary tract to cause infection. Um, Girls should learn how to clean from front to back, and also avoid use of bubble baths, scented soaps, to clean the genital area. While we encourage our children to go and void as soon as they are feeling the urge to urinate and take plenty of water during the day.
All right, all right. Thank you very much, Dr. Akinola, for sharing your expertise with us today. To our listeners, remember that a urinary tract infection is not just another fever. Early diagnosis and proper treatment are important, especially in young children, because repeated infections can sometimes affect the kidney. If your child has persistent fever, painful urination, foul smelling urine, unexplained vomiting, or keeps getting urinary infections, please don't ignore it. Seek medical attention promptly. Thank you for listening to Radio Doctor on 1.7. Thank you very much, Dr. Akela, for joining us today. Do have
Thank you. Thank you for
a
having me.
I'm Hassan Natula. Join us again next Monday for another informative discussion on children's health. Until next Monday, bye for now.
Thank you very much. No, sorry. Too much.